Welcome to Ask Your Midwife. Hello, good morning. Welcome to Ask Your Midwife. My name is Midwife Afrifa. Today's topic is on congenital abnormalities, but I'm going to limit it to the predisposing factors and then the preventive measures against congenital abnormalities. Please remember to share and subscribe, like my channel as well. On YouTube, it is Ask Your Midwife, or you can type Patience Afrifa, and then on Facebook, it is Ask Your Midwife. Alright, with the congenital abnormality, when we say a congenital abnormality, it's an anomaly that is seen at birth. That means baby was born with it. So realize that when a baby is born and you examine the baby, you find lots and lots of abnormalities which a normal baby is not supposed to have. For instance, an extra digit, which is most common, which you see. For the usual 5 digits, you realize that there is an extra digit there, or there is a missing digit. It's a congenital anomaly. Or at times, instead of the mouth being normal like the way mine is, you realize that there is an opening there. That's a hair lip. All these are congenital abnormalities. Yes. Then, what are some of the predisposing factors of congenital abnormalities? We have 2. That is the genetic factors and then the environmental factors. With the genetic factors, is due to a defect in the ovum and then the sperm. So during the formation, the anomaly occurs. Then with the genetic factors, for a few examples, I can talk about the polydactyly, that is the extra digits, and then the achondroplasia. When I say achondroplasia, these are people who have disproportionate stature. For instance, you see a man or a woman who is 40 years and looks like a 10-year-old or a 6-year-old. That is achondroplasia. Alright, then I'm going to talk about the environmental factors. With the environmental factors, I'm going to talk about maternal malnutrition, or a deficiency of certain nutrients that will cause the baby to have a congenital anomaly. The commonest I can talk about, lack of folate in the mother. That deficiency of folate can lead to what we call the neural tube defect, like the spinal bifida or hydrocephalus. That is babies with very big or large head. Their head is larger than their body. This is one of the anomaly I can talk about. Then we are talking about iodine deficiency in the mother. When a mother is deficient of iodine, baby is at risk of mental retardation. And also a pregnant woman who exposes herself to radioactive rays is at risk of giving birth to a baby with some of the parts missing, like a missing arm, a missing leg, a missing ear. It's possible that way. And then we can talk about effects of certain drugs. Certain drugs can lead to also missing body parts like hand or leg. Aside that too, it affects the dentition of the baby. As the baby grows, the baby's teeth becomes discolored, and no matter what you do, due to the drug you took when you were pregnant without prescription, baby will have that abnormality, which will go a long way to affect the baby for the rest of his or her life. Then we can talk about alcohol and smoking. Alcohol can lead to what we call the fetal alcohol syndrome. It can lead to microcephaly, that you give birth to a baby with a very small head. And bear in mind that the brain develops in the skull or in the head. So when the head is too small, how can a brain develop properly? So it can lead to mental retardation. Alright, so these are some of the things that will lead to congenital malformations in a neonate or in a newborn baby. So how do we prevent that? The first thing I can talk about is intake of folic acid. When you are planning on giving birth, you have to start taking folic acid. And when you are pregnant, you have to continue to take your folic acid in order to avert or prevent you from getting neural tube defects. Also alcohol. You do away with alcohol before pregnancy and during pregnancy. The same goes for smoking, either passive or active smoking. You have to try as much as possible, because there is a living thing growing in you who needs a good environment to thrive and grow well. Then you can also talk about genetic counseling before pregnancy. Why am I saying this? Because we have what we call the resource incompatibility. I last did a video on it, so you can please go back and then watch that video on resource or RH incompatibilities. These incompatibilities can lead to a whole lot of malformations for the baby, and a typical example is the erythroblastosis fetalis. So please go back to that video and then you can learn more about this RH incompatibilities or ISO immunization. All right, so these are some of the ways of preventing congenital malformations. If you have any question, please don't hesitate to do so. Kindly send me the question and I'll attend to you as soon as I can. Once more, the name is Patience Afrifa, and also please don't forget to like and share and subscribe to my channel, especially sharing the video, because you don't know who this video might go to help. I'll come back with some of these abnormalities. I'll take it one after the other for us to go through. Thank you.